Now, some of those survivors of the explosion will live with the day's trauma for the rest of their lives, and others will need a series of procedures to recover. Let's bring in skin graft specialist Dr. Edward Ngwenya, who's also the SA Medical Association's Vice Chairperson. A very good evening to you, Doctor. Thank you for your time today. When you look at some of the really horrific video and the extent of the burns suffered by these victims, what is going to be the necessary course of treatment?
Good evening, and good evening to your viewers, and thank you for having me on your show. Firstly, before answering this, I would just like to extend my sincerest condolences for this, tragic loss of life to the families, friends, colleagues, for these devastating events that have just taken place. But to succinctly answer your question, we often limit burns to its effects on the skin, and certainly what's going to cause harm initially is not what happens to the skin. What do I mean by that? The first thing is when you burn, we must know that what's going to kill an individual first is things such as the airways. Because of the swelling of the face, the edema around there, around the neck area, the pipe that takes wind to the lungs can get blocked and constricted. We call that airway obstruction, and so the person can be, can struggle and be unable to breathe. Secondly, what would then also follow would then be there are fumes that are around this area. There's carbon monoxide, the cyanide poisoning. There's different chemicals that are there circulating in the air that will then affect the lungs and cause one to demise. If not attended to, because they compete for oxygen. So instead of inhaling oxygen, your hemoglobins, which are your blood cells that carry oxygen, no longer take in the oxygen, but are taking in the carbon monoxide, and then end up unable to give oxygen to the rest of the body, leading to one's demise. And then we only get to then the effects that are caused by the skin. And certainly as a plastic and reconstructive surgeon, what I focus on is not just the skin alone, but of course what gets you there. And eventually when we have someone who's being able to go through, who's able to breathe, who's able to ventilate adequately, we can then look at the skin and look at the effects. What do we have, or what is the function of the skin? Function of the skin is to cause you to stop you from evaporating fluids. Now I'm using layman's language. The fluids that are within your body are not evaporating out because they are contained with that skin. The infections that are outside don't enter the skin. And there's various other functions. Temperature is regulated because of that. So when you lose the skin, when you lose that integral component, you lose the functions therein. Meaning we must give you fluids to resuscitate you because you've lost a lot of water, or rather, medically speaking, would be plasma, those fluids that are around within your body. You've also then are exposed to infections around, but then worst of all, and the part that would affect everyone in the long term is that if you lose that skin, you've lost your identity.
Right.
And you're no longer the Tembegile that we knew. And so we need to then come in at a later phase to see how we can then reconstruct, remove all that burnt tissue, and try to apply certain grafts, one of which may be skin grafts, to try regain that skin that you've lost.
Just on that process, then, where would the skin, for instance, for the grafts, be taken from when you consider that these are such extensive burns where, and I'm not going to be too graphic with this, where people's entire bodies appear in some of the videos to have basically had a layer of skin peeled off?
Oh, of course. So remember, we need to quantify how much the percentage of the burns is. In other words, how much relative to 100% your body surface area, how much have you lost? Now, once we've quantified that, it's also indicative, or rather would dictate the mobility therein. And we know generally people who've lost or who've burned, 60, 70, 80, 90% of the skin is off, seldom make it through. Only a minor percentage would make it through. So the amount of skin that you've lost relative to your entire body surface area will determine and is closely linked to whether you survive or not. But where do we take it? We take it where it's available. So if we've lost per adventure 10% or 20% of skin, we look to the areas. Plastic surgery is we borrow from Peter to pay Paul, but Peter's got to afford it. So I take in the areas that have skin that are available and put in the areas that don't have skin. But remember, where I take the skin, one takes it so superficially, we call it a split skin graft, take it so superficially so that where we've removed it, it can grow back.
Right.
But if we cannot use skin, we then need to look into other, measures that we can employ.
Just on, I want to hear more about the other measures that you can then employ, which some of these people, the survivors, will desperately need. But I'm also curious about whether it's a one-time procedure. I'd imagine they'd need to come in for multiple sets of procedures.
Of course. Remember what I've mentioned is before we even get to the parts where we've lost the skin, because we've lost that integral component, most of the, burn victims who've lost a significant proportion of skin, where the body surface area is extremely high, seldom survive because of other systems within the body that then don't function normally. But let's say now we've got a survivor who now requires skin. Then we look at other measures. We use autologous, in other words, let me layman's term, we will use what's in your body, which is the skin, failing which we then need to employ other things. And we look to, there are different options, as you've seen. I remember there was a child in Mill Park, as would know, who we used certain cells where we implanted in a specific region there. There are also allopathic material, in other words, when we use things such as, I'll mention a name, BioBrain, but these are artificially created, synthetic material that we use to then assist in that. But remember, you can never 100% replicate that which initially was. So if it's not a once-off procedure, a burn victim is often a patient for life,
right,
and they may present with complications later on.
And on that, the physical scarring and the skin graft or another procedure that will then be employed basically to reconstruct the person's being physically is the obvious part. What are the other likely long-term or in fact lifelong effects of such a serious injury?
All right. Now, there's the physical, there's the psychological. And the psychological part that I won't endeavor into, but one may, we are able to definitely, imagine the psychological impact therein. But physically, peradventure, you've bent around your elbow. Now, you've lost a significant proportion of skin around the elbow. What then happens? The skin, even though we then put in something that we may call a skin graft in that area, you may have contractions at the end. In other words, it may stiffen and stiffen and stiffen to the point that the arm can no longer extend to its full 180 degrees, and it may be pulled much in. If the eyes have been burnt, if the nose has been burnt, if the scalp has been burnt and you've lost hair, of course that hair will not go back again unless then we go into other procedures of hair implants later on. So the effects are quite devastating, and they can certainly affect one's function in future years, the functions of the hands, the feet, the eyes, and whichever part of the body is affected by the burn.
Dr. Edward Ngwenya, thank you so much for your time tonight. Skin graft specialist speaking to us about the physical process that will now have to be employed to help many of the people, 37 who are currently in hospital after the explosion in Boksburg this morning. We'll continue with our extensive coverage in the next 7 minutes or so and take you to one of our reporters who's also monitoring developments there.